My name is Lindsey Thomas, and I'm going to do the insulin injection demo. I would first check my 6 rights of medication administration: the right patient, right medication, right dose, right route, right time, and right documentation. I would then check my orders for my physician orders and my MAR, and then I would obtain the vials of insulin that I need, and I would check the vials for any discoloration, any particles, any problems with the vials. If it's multi-dose, I would go ahead and put my initial and the date that it was opened. I would then mix the vials in my hands for probably about a minute each, just to mix up the solution. And then I'm going to wipe off the tops of each vial. And then I would take my syringe and drop the amount of air, total the amount of medication that I'm going to have in my syringe. So in this case it's 30 milliliters. And then I would inject 20 milliliters into the NPH, or the cloudy vial, being sure not to touch the medication. And then take it and do the same thing in the clear. Put the rest of the air in there. I'm going to draw out the clear medication, which is the 10 milliliters. Make sure to dislodge any bubbles. And then I'm going to go ahead and stick it back in the cloudy vial and withdraw the other 20 milliliters. Being sure not to push any back into the vial. Once I have that finished, I'm going to recap the needle using the one-hand technique. I'm going to take that to the patient's room. And in the patient's room, I'm going to verify the identification using full name and date of birth. Then going to explain the procedure to the patient. Going to check for any allergies, ask the patient if they have any allergies. Then I'm going to find the right location, usually on the abdomen, to give the injection. With someone who is a little heavier, we would do a 90-degree into the subcutaneous tissue. Someone who's a little smaller would be a 45-degree angle into the tissue. I then wash my hands and apply my gloves. And then I'm going to wipe off the skin of the patient, starting in the center and going outwards about 2 inches. And I would let that dry for a second. And I'm going to pinch up the tissue of the patient and inject quickly, and slowly inject the medication. I'm going to return the patient to the comfortable position. I would discard the sharps in the sharps container, except for right now I don't have one, so I'll just use the one-handed technique to cap off the needle. Then get the patient back into a comfortable position, and I would document the dose, the time, and how the patient handled the procedure, And then that's it.